welcome to another edition of Pet Matters. My name is Dorothy Claeys, and I'm the Executive Director of Francisvale Home for Smaller Animals, which is located here in Radnor, Pennsylvania. Francisvale is one of the oldest continuously operating, no-kill, nonprofit shelters in the United States, having been started in 1909. Our mission is to provide loving care to abused, surrendered, unwanted, and/or abandoned companion animals while seeking permanent homes for them. Today, I'm joined by my guest, Dr. Joyce Riveroll. Welcome, Dr. Riveroll, and thank you so much for joining us today.
Thank you so much for having me today, Dorothy.
So let me just preface our discussion today by talking about the relationship that Francisvale has with Penn Vet. Francisvale is extremely fortunate to have Penn Vet collaboration that was started in 2015. We reached out to Penn Vet to help enhance the lives of the animals that were living at Francisvale at the time. We had some dogs that had been there for longer than they should have been, and we were hoping that we would be able to give them a better chance at adoption if we brought someone in to work with them. So each year we have an intern from Penn Vet, and that intern comes to Francisvale and works with our staff, our volunteers, and our animals. And Dr. Riveroll is our intern for this year.
Yes.
So the program is such an interesting one at Penn Vet. So it appears that there's only a handful of schools that actually offer a certified behavioral program in the United States. Can you tell me a bit about the program that they have there?
Yes, the program, for example, there's only like 5 universities that actually have this program, Penn Vet being one of them. And you usually have to have like a year of an internship, and then you go into a residency, which is going to be 3 years. During that time, you're going to be learning about behavior and welfare in companion animals, in exotics, in laboratory animals too, and zoo animals. So after those 3 years, then we have to present boards, and then that way you can, if you pass the boards, of course, then you become a certified board veterinarian behaviorist.
Okay, and now this is only available to people who are already veterinarians. Is that correct?
Yes, yes, you have to be, because that's the title, is veterinarian behaviorist. There are different behaviorists, but not veterinarians.
Okay. Now, what attracted you to this program?
Well, the opportunity to become a board certified behaviorist, that is something that I developed an interest in getting to, in becoming. So this university is like, it's a very important university too, and I like the program, so that's what I actually got my application into, and then I was one of the chosen ones.
Right, and we are so lucky to have you.
Yes, thank you.
So now, you know, you've been a veterinarian for some years, and why did you want to focus on behavior?
When I entered school, I mean, I entered like many years ago. I finished on 92, actually. That's when I finished. I have gotten my degree, and I always liked behavior. I feel that at that time there was not enough talk about behavior. Animals were like not, medicine was the most important thing, but their behavior was not taken into consideration. And even then I thought, you know, like, it's very important, because these behaviors these animals have, they impact on the lives, either on humans or on themselves. So I started studying, trying to get this knowledge a little bit more. Unfortunately, at that time in Mexico, we didn't have like the assignment as it was itself, like behaviorist. It was a different thing. It was not, we didn't have it at that time.
So you mentioned Mexico. So did you go to veterinary school in Mexico?
Yeah, I went to the National University of Mexico, la UNAM, which is our the biggest university we have in Latin America, actually. That's where I got my degree.
Okay. And one of the things I know that Dr. Riveroll and I have talked many times, and one of the most fascinating things I think that you've done is work with wolves.
Yes.
So tell us a little bit about your experience there.
I was also so lucky as to get working at the International Wolf Center, which is located in Ely, Minnesota, with a pack of captive wolves. They are socialized, but they are not, of course, domesticated. And this place is amazing, because what they're trying to do is they are teaching about the life of the wolves. You know, these guys, our pack is, they are the ones who are teaching about how wild wolves actually live, debunking so many myths, about the big bad wolf and stuff like that. So they are really very important. We have a lot of people coming through the doors at the center, and we have a lot of interesting places to see in there. Like we have videos, and then we have the observation windows, and we have lectures over also every hour. So they're ambassadors for their species.
Now, is that a place that people can go and visit?
Yes, they can go and visit. It's open every year. On summer, it's a good time for them to be visiting because it's open 7 days a week. On winter time, they're only opening different, because it's the winter in Ely, Minnesota, it's a big one. I mean,
much colder than today, huh?
Yeah, I mean, we're talking about -40 sometimes, so it's kind of difficult. So they open like 2 or 3 times a week, but then you can see a lot of these behaviors that they will perform different during summertime than in wintertime.
It must have been a fascinating experience.
It was. I mean, the curator, Lori Schmidt, she's amazing. She's a very knowledgeable person, and everybody working in there, they're just amazing. I mean, the way people are in Minnesota, I mean, they're very friendly.
Okay, well, that sounds like a wonderful background. So let's move on to what you're doing today. So now, with your clients, I understand a large portion of the time that you're at Penn, you're also seeing a lot of clients.
Yes.
Both the 2-legged kind and the 4-legged kind. So what are most of your clients that come in, are they dogs? Is it cats?
We have both of them. Actually, the big chunk of clients are actually dogs. I mean, those are the ones we see more. But we're starting to see a lot of cats because now people are understanding that when a cat is just like doing nothing at some point, that is also a problem. So we also run different kind of programs to help people understand that they have to take the animals as soon as they see, like the first signs of behavior problems in order to catch them on time and start like working on them. We've seen families coming all together, animals that are owned by only one person or two persons. So yeah, I mean, we have like a lot of dogs and cats especially. Those are the ones we actually see in Penn Vet School.
Okay. Have you seen, is there any other species that you see there, or do you find it's just really those two?
Well, you can actually see, but you have to go to the New Bolton Center. That's where you see horses and large animals. But that's in a different part, and they have also some special person for seeing behavior in horses.
So nobody ever's coming there with a bunny or a guinea pig or something and tries to figure out their behavior?
So far, I haven't had any of them. So far, no. I mean, we can get probably a couple of like questions. Someone would send an email, and then we just kind of redirect them to someone else. Or if it's something like we already seen, then we can actually tell them.
Yeah. So with all this, all these appointments and all the people that you've seen, what do you? What would you say is the most common behavior issue with regard to dogs that you see?
With dogs, the one that we have more right now, I think it's a little bit of this anxiety and fear towards unfamiliar things sometimes, like going outside or getting used to cars or people, and dogs who are not very well socialized and they don't know how to behave or have their language between themselves, so they're kind of afraid of different dogs that they don't live with them. So we've seen that a lot.
So that's the majority.
Yeah, the majority are fear-related problems.
And how about cats?
Cats. The funny thing with cats is, and it's the one that is like the most, is inappropriate elimination. So cats peeing somewhere around the house. That is the one that we see most. And what we call playful aggression, because people tend to play a lot with the hands with the cats, and when they're kidding and they start biting, it's kind of funny, but when they become a little bit bigger, it's not so funny that they continue biting at you.
Right. So I'm going to give you 2 scenarios, if I may.
Yes, sure.
And this is where we're going to give our viewers some perhaps free advice. So my first scenario would be, I'm going to come to you and I'm going to say, well, my dog is so distracted when I'm walking him. How can I get his attention and keep it so that when I'm walking my dog, he's with me?
Okay.
What type of advice would you give me for that?
First of all, I will let you know, like, walking is a part of the day where they are actually going to understand the way outside works. Like they're going to be seeing all these smells, all these sounds, scents left by other dogs. So it's kind of their Facebook. They're going to go and they're like, oh, this dog passed by and this is what's happening. So allow them to sniff a little bit, great. But then one of the things that you can do to get him focused on you is teach him how to look. So you have to always use positive reinforcements. We always tell them, like, get treats ready. Treat that the animal is going to be into it, like he likes, and work first in the house when there's not a lot of distractions. Work with a cue. We call them cues and not commands, because command is like, you have to do this, and a cue is more like, hey, let's do this, and if you do this, we're going to have, like, treats in there. So try to get his attention by this cue, which means, like, get the treat and get it into your eyes, and then every time he turns around and looks at you, you have to use a marker word like yes, good girl, good boy, whatever you choose. So look at me, I'm like, first like this, yes, and then give the treat. In the house, then when the animal is offering that behavior, like, regularly, he's going to be looking at you, you said yes, and then good dog, and give him a treat. Then you can mark that behavior and say, like, look at me, oh, yes, and then give them the treat. You start in the house, then you start adding some distractions, like the TV, some of the other person of the house walking by and stuff like that, and then you move on the outside. On the outside, always bring really good treats that they're going to be like, oh yes, I'm going to do things for that treat. Oh yes. And then the same thing, start walking with them, and every few steps they're like, look at me, yes, and give the treat. And that's the way you're going to get the attention from your dog.
Oh, it sounds like a good practice.
It is a good practice.
It doesn't seem too hard to learn.
No, and especially because practicing with an animal is not like, it doesn't have to take a lot of time.
Okay.
It's just a couple of minutes, like 2 or 3 times a day, but no more than 2-3 minutes, because that's all they can hold their attention span. It's just like, if you try harder or like longer period of time, they're going to lose interest, and we're going to become frustrated, and then we're going to raise our voice, and then they're going to be like, wow, this is not fun anymore, and then we're going to start breaking the relationship with them.
Right.
Training always have to be fun and short.
Sounds good. So now for our cat people, I have a cat, and he's urinating outside of the litter box, which seems to be a very common issue, as you said. So what should I do?
First of all, we have to make sure that the cat is not having any medical problems. So I will take him to his primary vet first and see if everything is clear, there's no problem like that, like a urinary infection or something. Then we start thinking about behavior problems. What you can do is first check about the substrate you're using, the litter by itself. If it's one that has like perfume, cats, they don't like that really. Perfume is not a good thing. Also about we have pellet kind of form litter. We have like the granulated one, the one that is kind of like a very porous, like and sand. So check which one is the preference for that. Also the litter box by itself. Sometimes we get like a big litter box, because we don't want them to be like, whenever they scrape, like throwing it outside. But if the cat is an older cat, it may be having some troubles getting into that litter box. So we usually ask for a litter box that is like as big as the cat and a little bit more, so the cat can turn around, a little big like this, so he can actually walk in easily. And then here's 2 things. If we're using a cover litter box, some cats, they don't like that because the smell gets in there, and it's kind of like an ammonia smell. So it also depends. If the cat is used to those ones, it's fine. Just clean it at least twice a day, and we recommend changing the litter, the whole litter, about every 2 weeks, and then washing with some warm water and a little bit of soap, and then cleaning the litter box all by itself about once a month, twice a month, depending on how many cats, you have.
Okay, sounds like sound advice.
Yeah, it is a good advice. I mean, we forget that, like cats are very clean, and if they step on that litter and it's not clean, they don't want to use it, so they're going to start to use it outside. Place it also in a place where the animal is comfy, because we try not to place it on, like where there's people passing by, because nobody wants to be doing their business and people walking by, or something falling on them, and then cat's gonna, oh, I got scared, and then he may associate the litter box with something that happened.
Right.
So I'm not getting in there, because every time I'm here, there's a sound.
Right, and some privacy, please.
And some privacy for them.
So when we talk about behavior, how likely is it that we are changing the animal's behavior, or is it more likely that we're just managing the behavior?
Well, it's just like they all come with their, I mean, we all have our own temperaments. So you can actually help modify the temperament as needed. Not is going to be taking all the animal's behavior by itself. We're just trying to make sure, like for example, sniffing is a behavior that it's going to be there, but we don't want them to sniff, for example, dead meat or a rodent on the street. So we're going to try to modify it and then get their attention and display that behavior in a context that is acceptable. Like, you know, like I want you to sniff a snuffle mat. So we're going to be using that behavior that the animal has and modify it to a place that is acceptable, like a snuffle mat inside the house, or when we're trying to play with them one of these treasure games, something that is okay for us. Some behaviors that are not, for example, we have to understand the need for the animal to have, you know, comfort. So some animals, they're like, I like this bed and I don't like the way you are telling me to get down off this bed. So instead of just like confronting the animal, we offer an alternative behavior. Hey, if you come down off there, you're going to be, you know, like if you do a touch and come and touch my hand, you're going to get a treat, and then I would redirect you towards something that I really want you to do. But we never want to confront an animal directly.
So it's really about, you know, giving them something else to do that's a more acceptable or more pleasing behavior.
Exactly.
Than what they're doing.
That we're doing, exactly. The same thing with an animal is scratching or biting. Instead of like yelling no 50 times, because the animal, as soon as you yell no and he's like, oh, she's gone, I'm going to start again. Get his attention and then redirect towards something. So his mind gets off this thing and then he's occupied on something else.
So how many times do you see aggression in a dog that is just something that can't be helped?
Well, first of all, I want to tell you that aggression is a normal behavior for any society that has members in their society. That is aggression, because if we and I were the only humans in this place, and this is supposed to be I don't know, let's call it a plate of meat, and we are the only ones. At one point, even if we share like humans, we can share. If you finish your part and you want to have my part, I will let you know, like, this is not acceptable, this is my part, and you'll be like, I want it, and then we may go into a fight just because we need survival. But of course, it's not well seen, the aggression. So we have animals who have become aggressive towards their owners due to, I don't know, aversive training techniques, or due to pain, or a lack of socialization, things like that. So we've tried to avoid these confrontations, and we try to manage some of the animals with behavior modifications, environmental enrichment, and sometimes we need medication. But all of those are the three things we use together. Some animals will see some improvement, unfortunately on some of them due to circumstances by their own animal or by the house they're living in. We don't see a lot of improvements in those animals.
So we touched a little bit on positive training and things of that nature. So I just wanted to say at this point, it's very important for people to know that trainers and behaviorists are not really regulated.
Yes.
So, you know, I could put a card out there, a business card, and say I'm a trainer, I'm a behaviorist. You know, I could tout my own skills, and they may not even be skills. And then, you know, it's up to the person to really see and investigate whether I would be a good, you know, good for their animal. So, you know, people are always, you know, saying, well, I always get a trainer, or, you know, maybe a behaviorist. So when do we know which one to go to? What, you know, what is it that we should say, like, well, I really need a behaviorist in this instance, or I only need a trainer?
Okay, there are a couple of things that I want to say. Like, it's like trainers are always, we rely on some trainers, some of the good trainers. We rely to help them continue with what we establish as a plan of work for our animals, for our patients.
Okay.
So what you have to see looking at trainer, for example, if you are trying to, you know, something easy like house train the animal, you know, like to get them to go to the potty training, that way you can actually talk to a trainer and tell them, like, oh, I need this. If the behavior is becoming so more upset for you, and you have tried, you know, exhausted some of the things that the trainer told you, and there's not something's happening there, then you can come and see us, and then we can say, like, okay, it is only related. As a behaviorist, as a veterinary behaviorist, we tend to see the whole part of the animal. We tend to see the medical problems that they may have, or the medical issues and also the behavior ones. So we try to put in a context like, okay, this is an animal, an older animal. Is he losing, like the ability to go to the bathroom, or he's very young? And then once we establish that, when we can start working on a plan for you, for the patients. I will always say, like, you have to check the reference from your trainers and behaviorists. Regular behaviorists cannot prescribe medications. That's what we are, the veterinarian behaviorist. That's one of the main difference between, like we know more about physiology of the animal in the whole context. And the trainers, I will always say that this has been advancing so far right now that you have to check that the trainer has been updating his knowledge, because if you see and use trainers that they use like old words like let's do an alpha role or a dominance behavior, that is something that we don't use anymore. We know that those kind of thinking hasn't been actually being the underlying issue of a lot of behavior problems, because that was an old thing that was like it's already in the past. We have evolved into a more comprehensive communication with our animals.
So we're talking, and I know that Penn Vet is a great proponent of this, of positive reinforcing and positive training. So I know there's a lot of people out there who think that you have to really punish the animal to get them to do what they want, but that is just an old school theory. It
is a school theory, yeah. I gotta tell you, punishment does work. I mean, I have to be real. It works because the animal is so afraid of being punished that he's going to be doing the things that you're telling. So you have a very fearful animal or anxious animal, and you really teach him to sit, by punishment. He'll be sitting there, but he won't be relaxed doing whatever you're telling him. So next time he encounters that stimuli, or as long as he feels release, he may continue with this anxiety, and then another behavior will become problematic. So instead of doing that, which also punishment breaks the relationship between the owner and or the guardian and the animal, if you start doing a positive training, yes, it will be a little bit longer, but then you're going to make a better relationship with your animal. The quality of the time you're going to be spending, it's going to be amazing.
That's wonderful, yeah. So now, we know that it's common knowledge that shelter animals have a host of issues. Many times we have no idea where they've come from or what happened to them prior to them coming, especially when they arrive at Francisvale. So one of the most important features of our collaboration is what I like to say is our the 3-month follow-up with Penn Vet. So any adopter at Francisvale, whether that be adopting a cat or a dog, will have at no extra charge 3 months of follow-up with Dr. Riveroll or whoever is our intern at the time. And so what we're trying to do is make that transition from the shelter to the home a successful one.
Yes.
And so Dr. Riveroll has worked with a lot of our adopters to try to do that for us. We certainly don't want the animals back, even though we would take them back. So what have you seen now with the adopters since you've been at Francisvale? Are they the most common issues that you've been working with, and how successful has the transitions been? Well,
that is one of the excellent points. Like, this partnership is amazing because it allows, first and foremost, try to help the animals in a situation of a shelter, which by itself, even though Francisvale is a great shelter, the animals still kind of like anxious in there. So we can try to work with their anxiety, implement environmental enrichments, and like the toys that we're giving them, all the things that we're doing in there, which actually help them be less stressed. Once the animals is adopted, of course, there's this period of stress because they come from a place where, like, for example, our cats, when they're in a big cattery with other cats, and now they're in a home which is bigger and all by themselves. So the clients that we have that have adopted and that contact us, they come with their regular problems, like, oh, it's the cat is hiding for a little bit longer than I want it to be. So we just discussed about, give them time, try to have, like, entice them with little toys, treats like that, kind of like get them into a smaller space at the beginning, and then slowly start them getting out into the rest of the house. The ones who are having trouble with inappropriate elimination, the same thing. Try to tell them, okay, this is they will send us, like, oh, this is the plan of my house. Okay, let's try and put one litter box here, and one there. So I think people are understanding more and more that a shelter animal can be go into a home life, and of course it's going to have some kind of issues, but it's nothing that they cannot work with. I mean, they are as loving as any dog that you can raise as a puppyhood, because they are very grateful animals, and they also have their own issues, but that makes them unique and very special.
So we just, people should just be prepared that it could take a transitional period. And so it could take what, maybe a week up to a month or even longer?
Yeah, try about 3 months.
Oh, about 3 months?
Yes.
Okay.
Especially because of the animal, I mean, when you adopt an animal, or even if you have a puppy, he's not going to be your animal until probably 1.5, 2 months. Okay. And the 3 months are like, okay, now I understand the routine in this house. Now I understand my part in this place. So that's when you're going to be able to see more of their relaxed behavior or their natural behavior. Like you're going to see cats perching longer into, like shelvings, or dogs actually doing a bit of a barking, and you're like, this dog didn't bark at the beginning, now he's barking. Yeah, because now he feels so key in the house, he doesn't feel like he needs to be quiet. So they're performing more of their normal behavior.
So you have to have some patience and love is probably the two best things you could give a shelter animal coming into a home.
Yes, shelter, love, and a routine. Like try to get them into a routine as soon as you can. We're going to wake up at this time, or you're going to get fed, and routines are good for animals because that's what tells them, like, this is my life, my regular life. This is what's happening. So I can just like get at this in this time of when I know what is expected of me. Right.
So I can imagine some people are watching our show thinking, oh, I really need help with Fido or Princess, and I'm at my wit's end. I don't know what to do. So how can someone, get to Penn behavior medicine?
Yeah, if they go to the veterinary hospital website, there's a link in say like behavior, and then if you click in there, that's the way you can actually contact us. And you can make an appointment with Allison Seward, who is our assistant, and from there we can just she will just say we have 4 behaviorists in the service, so you can add with either one of us.
So if we're coming in for the first time, what can the person expect? Would they be there for a long time? They bring their animal with them, those kind of things?
Yeah, we ask them to bring the animal with them. It's going to be about, it all depends, they have to fill in first a questionnaire, send a questionnaire. The questionnaire is sent to us, to whoever the clinician is going to be taking that consult, and then we studied the questionnaire, and then we start seeing what may be the problems from the animal. With this questionnaire, we're going to have some questions for the owners, and then on the day of the appointment, we're going to be seeing the overall behavior of the animal since the moment he comes through the doors. So since there we start checking the animal, then we see it, we ask the questions that we consider pertinent for this animal, and then we start, it's kind of a long appointment, longer than the usual one, because it's about 2 hours, 2 hours and a half appointment, and that way we're going to be able to talk and discuss about the plan that we may have for the specific animals. Each one is done individually. Okay. So if you have 2 animals and they are in trouble, 2 different, yes.
Okay. Even if they're having problems with each other?
Yes, because it depends which one is happening. One is a trigger for one thing, and then the other one may have a different trigger, and then the result will be the fighting, but it's like different animals.
Well, it's comforting to know that Penn has such a great program, and that you guys are working towards helping our animals and our furry friends have a better life. I had so many more things to discuss, but our time is really running out, so I'm going to have you back at some point.
I would love to.
But thank you so much, Dr. Riveroll, for joining us today. And for our guests, so be sure to check our website at francisvalehome.org, and please join us on our Facebook at Francisvale Home. And until next time, this is Dorothy Claeys for Francisvale Home for Smaller Animals, the shelter where every pet matters.